Hello and welcome our favorite people to our integrative and functional Laccura Medical Spa and our YouTube channel. Here on this YouTube channel, we will try to provide you with information with the newest ways in aesthetics in medicine. We are nestled in the North Shore suburb of Chicago. We do offer a medical approach to all of our patients. We have multiple blood test panel, comprehensive, metabolic, hepatic and renal panels. We check thyroid, completely thyroid panel, and all of the vitamins. It's very important to address deficiencies that the patients might have. Even simple group B vitamins deficiency lead to dry skin, decreased collagenesis, and patient will not see the benefit after the collagen stimulating procedure. Vitamin D is super essential for our body. It protects us from photo damage, increases the skin regeneration, cell turnover, and protects us from aging. Iron. Iron is very important for our thyroid, and if we have disbalance in the iron, our whole body is falling apart. We see it in hair loss and just not feeling well in general. It is important to address hormonal changes that people experience with age. We do have male and female panels, and we do help replenish the hormonal disbalances. It's not just about putting the fillers when everything is just sagging down. We need to restore the elasticity of the ligaments, the elasticity of the skin, so the fillers will stay better and have a better aesthetic results. In our wellness center, we do provide medically supervised weight loss. When we start, we do full blood test workup, and our patients are meeting with our medical staff on a weekly basis. We monitor the progress, not just about the pounds, but also about the muscle mass and fat percentage. We have in-body machine, which is a full body analyzer that helps us identify muscle percentage versus fat percentage and monitor the progress. It is the newest technology that helps us educate, empower, and monitor patients' progress in a way that was never done before. This newest technology also helps us analyze the deepest fat, the visceral fat that sits around our organs. And when we monitor our patients on a monthly basis, the patients can see the progress and improvement in their fat loss and muscle buildup that helps him stick to their exercise routine, follow the nutritional goals, and actually prove that our treatment plan is beneficial for their wellness. Also, in our treatment plans, we do incorporate peptides. Peptides are amino acids. They work magic for our body. They help us fight against infection, stimulate elasticity of our skin, fight wrinkles, hyperpigmentation, build more muscle, and lose more fat. They help us reduce the inflammation because they work as an antioxidant. They are critical in many biological functions in our body. We do use peptides in aesthetic as well. It helps us restore the scar tissue, heal wounds, fight wrinkles and hyperpigmentation, improve skin elasticity and firmness, and fight photo damage and hypersensitivity of the skin. In our wellness center, we do have multiple IV options: anti-anxiety, migraine, cognitive booster, Myers cocktail, and also very popular protein neural therapy that helps you fight against chronic inflammatory symptoms and diseases, psychological diseases, and chronic pain. Chronic pain can come from physical, emotional, and mental issues, and Procaine is a magical. We have NAD, ketamine, and glutathione IV infusion options as well that help you restore your mitochondrial level and improve your ability to function on a daily basis. Also, we offer genetic testings to find out any gene mutations that help you restore your vitamin deficiency and help you with developmental changes in children and adults. So please call us for consultation. Let's go and see how we do our first consultation with the patients that I just met. So we are ready to introduce our next patient. Actually, I met Randy today, like 5 minutes ago. He's our new patient at our clinic. And let me take you through our first time consultation with Randy.
Great, I'm happy to be here. My name's Randy. and I'm happy to be here. Thank you for meeting with you. I heard about you through a friend. Yeah, actually my husband has been here for some treatments, and so he recommended you, so.
Okay, so what brought you here today? What concerns, questions you have for me today?
Where do I start?
How old are you?
I'm 54, and in April I'll be 55.
Okay.
So thank you. But you know, I'm at that age where I try to do as much as I can to really take care of my body. You know, I try to work out. I take vitamins. Sometimes that's a little hard to stick to it, or I kind of get tired of taking them. But I do struggle with some inflammation. My recovery after workouts isn't as great as it used to be. So I'm here to see if there's some other alternative things I could be doing to take better care of myself.
Okay, let me ask you a few questions.
Sure.
Do you have any medical diagnosis that you are aware of, like your other doctor told you about it?
I do not.
Do you have any autoimmune diseases?
I do not.
Do you take any medications on a regular basis?
I do not take any medications.
Are you taking vitamins?
I do.
What vitamins do you take?
I take nutraceuticals. So I take DIM, I take curcumin, methyl factors, vitamin A, vitamin D, vitamin K. I'm a vegetarian, so I try to make sure I'm getting my B vitamins and things that people tend to get through meat and stuff.
Okay. You mentioned that you are working out.
Yes.
Okay. When was your last blood test?
About a year ago with my doctor.
Okay.
Yeah, it's fine.
So we usually recommend people, they can get full blood test panel here. We check for all the vitamins, all the electrolytes in the blood. Of course, thyroid panel is important to get done. We check your kidneys, liver numbers, vitamin levels, and then we can recommend you what IV vitamins infusion you can get here. You also mentioned that you are vegetarian.
Yes.
Are you getting enough proteins in your diet?
I do. I think I do. I eat a lot of legumes. I take a vegetarian, or actually a vegan protein supplement powder. But the blood work, I think my doctor just does basic stuff. So having thyroid information, I think would be really interesting to see if that shows anything I could be doing.
All right. So we also offer food sensitivity panel. Sometimes people, they're thinking, oh, I'm eating oatmeal, like it looks great, it feels great, it's supposed to be healthy for me. But sometimes people have food sensitivity. It's not the allergy.
Right.
You basically don't have any vivid symptoms of allergy, but you may feel fatigue, brain fog, or some joint inflammation just from getting foods on a regular basis. A lot of patients, they realize when they get this test done and they say, oh, I eat this food every single day. It can be cucumber, meat, shrimps, like some fruits and vegetables. So we usually recommend to get this test done as well. Okay.
Yeah, sometimes, I'm a school teacher, and so there's a lot of stress wrapped up as a teacher. And, sometimes I do have brain fog, and I don't know if it's just a result of the stress of my job or if it's related to food or nutrients that I'm getting or not getting. So, I think that would be helpful.
Okay. So we'll start with the blood test. We'll get the nurse, we'll put the orders in, and we'll run all your panels, and then we'll see what it will show us. Okay. So we can recommend you next on your next treatments, which IV vitamins to mix in your IV vitamins infusion. I know you mentioned that you are taking nutraceuticals, but people do get pill fatigue, and they're not very legit with it. So sometimes it's better to get the IV infusions instead of oral supplements because they do have better bioavailability. Whatever you take by mouth, it's not always 100% bioavailable, but IV vitamin infusions, they have 100% bioavailability. So, and people usually feel great relief of their symptoms even after the first IV. And we do have great IVs here. We have Myers cocktail, like immune booster, cognition vitamins. We do have NAD, and we do have a new vitamin infusion, protein, glutathione. So we can talk about it more once we have your lab results ready.
Okay, that sounds great. I also have concerns about hair loss. So I have started taking a nutraceutical that's for hair loss. So and that's been about 2 months, but I'm interested in what products are out there to help with that.
Okay. So hair loss can be due to a lot of reasons, vitamin deficiency, stress deficiency, even hormonal deficiencies. So like I said, we'll add more labs to your lab panel. You know, as we talk, I know exactly what to order for you to see why you're having hair loss. And sometimes, you know, our lab does not show everything. So for the hair loss, we do have genetic testing that we can perform on your saliva. A lot of times people take vitamins and they just don't absorb them properly. So these genetic testings, they show us what vitamins are best for you and what medications are best for you for your hair loss. Instead of just trying this and that, you know, like there's a lot of different products on the market.
Right.
And if you're saying you're taking something but it's not working for you, let's get you tested and see what your body will be accepting properly, so your body will have a more beneficial response to the supplements that you are taking and to the treatments that we can recommend for you here.
That's helpful because, you know, I think for a long time I was taking turmeric, and it wasn't until maybe a year later that somebody mentioned, well, when you take turmeric, you want to make sure you're taking this other supplement so your body could digest and absorb it. So I think having that information would be really helpful to me.
Randy, I know you mentioned you're taking DIM. What is the reason for you to take it?
I take DIM, you know, I was introduced to it when I had some pellets for hormone optimization, and I just kind of stuck with taking that nutraceutical and made it a part of my daily regimen. But I felt like the pellets didn't really do much for me. I didn't really understand what I would experience, and just the follow-up from the doctor and their office just kind of fell through, and so I kind of just gave up on it.
When did you try it, and how long did you try it for?
It was probably 2 or 3 years ago. I did 2 rounds, so I did it was probably, you know, I did my first set of pellets, and then 5 or 6 months later my second round of pellets, and then that third round I just never did because there was no follow-through or anything. So
okay. You probably heard about it. Pellets are different. You know, some pellets are synthetical. We do have bio-identical pellets here, and we usually run full blood test, of course, and we discuss the symptoms, what your expectations from it. I think it can be a great approach for your general health in general, because for guys we usually do testosterone, and testosterone is a great anti-inflammatory agent, natural, bioidentical, with the same receptors that your body can respond better. Since you mentioned that you're having like pains, aches and pains, inflammation in your body, slow recovery after physical activities.
Right.
I think a lot of people can benefit from this, and especially you know, since you mentioned all of your symptoms and your age group is appropriate, you're still active, you are the teacher, you know, so we want you to have as much energy as possible to teach our kids so you guys can have fun.
Thank you.
Other questions for me?
Well, one of the things I do have a question about is, you know, just taking better care of my skin and how I look. You know, I'm 54, I'm going to be 55, and I've had a lot of sun exposure. I used to be a lifeguard before I was a teacher, so I feel like those things are all catching up with me. I notice more wrinkles and more age spots, and you know, gravity is starting to take a toll. So yeah, I really want to start taking better care of my skin. So anything.
Do you have any skincare that you use at home? Do you have any regimen at home?
I actually don't. Once in a while I'll use moisturizers. I'm a big Dr. Bronner fan, so I use Dr. Bronner's soap for, you know, my hair, my face, my body. But yeah, you know, I read labels and it's just like, I feel kind of lost. Like, where do you even start?
Okay. It's a great way to start with a home regimen at home, because you can come to the spa and get some treatments done, but 90% the way you look is what you do at home. So we can go in the front and we can discuss which skincare we can recommend for you. And we can discuss it with you during our next visit when you visit our clinic and our practice, so stay tuned. If you like our video, subscribe, like, and share. Put your comments below and let us know what other questions you have for us, what other treatments you want us to discuss with you. Your feedback is important to us.